y'all do not stare. Hey guys, welcome back to another video. In today's video, I'm going to be going over how I chose my boards patients for my clinical exam. I want to show you guys some x-rays and just go over a little bit of what my exam was like. So just a little bit of a disclaimer, guys. Remember, I am in Florida, so the exam that I took was the CDCA/ADEX exam, which is not always the same for different states. I believe the CDCA is accepted in about 44 different states, so this is just based on my experience. In order for me to get my license, I had to take 4 exams. So one was the laws and rules for the state of Florida. I had a computer simulated exam, the National Dental Hygiene Board, and the clinical board. This video, for time's sake, is just going to be based on the clinical board patient and how I chose my clinical board patients. I want to show you guys the x-rays that I have, and yeah, I hope this video is helpful for most of you guys. If you guys are liking my content, please make sure you hit the like button, hit the subscribe button. That's the only way that I know that you guys are watching me and are truly interested in what I'm saying. So please, guys, support me. That way I can help you guys as well. So let's get started into the video. All right, guys, so the first thing that I made sure is that my patient was a little bit more on the younger side. So the reason for this is I'm sure you guys know now, if you're in school, if you're, of course, if you're getting ready to take your national boards, you've already gone through most of your hygiene schools, so you've been seeing patients and you know the difference between a young person calculus and an older person calculus. The less the person has had the calculus there, I guess the better and the easier it is for you to remove it. So one thing that I always had in my mind is to pick like more of a younger person, because the calculus is going to be, quite frankly, a lot softer and a lot easier to remove. So my patient was 18. In my state, they have to be at least 18 years of age. So guys, before I get deep into this video, I just want to touch base a little bit on on knowing your boards patients and just making sure that they are somebody that's reliable. So this is huge for you guys. So choosing somebody that's going to be there for you, that's going to support you. So ideally, guys, if you can and if you do have a family member that meets your requirements, I think that's kind of a best bet, because you know that they're going to be there for you and they're going to support you, and you need somebody that's going to be reliable, that's going to show up to your exam and just really be there. You know, you do have some difficult patients that sometimes are very sensitive, and at least if it's a family member, they'll kind of put up with it until you're done. Now, I'm not saying that this you know that you're going to hurt them or anything, because we are, you know, we learn in school how to properly do what we have to do without hurting the patient. But you know, we've all had that very, very sensitive patient. We've all had that patient who everything hurts, you know. So you really don't want somebody that's going to be really sensitive. Of course, it's hard to know, but at least my school allowed us to screen patients ahead of time, which I'm hoping that most of you guys' school allows you to screen patients, which means just going in there and feeling for calculus. So some of my requirements, guys, and this, like I said, it's just the state of Florida. I'm not sure if it's like this in different states, but some of my requirements were I had to have 12 surfaces of calculus. These surfaces with calculus had to be felt with the instrument. These 12 surfaces had to be really a bump of calculus. So there wasn't like, you couldn't go in there and kind of guess like, oh, I think there's calculus there. No, there had to be a significant bump. And that is because the judges back there, they're going to go in maybe 2 strokes to feel, and that bump has to be there. Definitely, if you can see the calculus on the x-ray, you know that they're going to feel something there. So when you're choosing your x-rays, guys, when you're choosing your patient and you take your x-rays, you want to make sure that there is calculus visible in the x-rays. So this is huge, because when the examiners go in to feel for calculus, more than likely they're going to feel the calculus there if it's visible on the x-rays. So it is big enough to be on the x-rays, so more than likely they're going to feel it. So you don't want them second guessing. You don't want to be unsure if there is calculus there or not. You want to be sure that there is calculus. So another thing, when you are choosing your patient, I don't know about in other states, but in Florida, and I'll put a closer picture, you have the option of taking a panoramic and 4 horizontal bite wings with you, or an option of taking a full mouth series of x-rays with with your 4 bite wings. So remember guys, you are graded on your x-rays as well. So overlap and all of that is also graded. Luckily, my college allowed us to screen our patients before ahead of time, and quite frankly, if we had an overlap, we had to retake it. Luckily, I don't think I retook that many. So by the end of your 2 years, you know, you are pretty good at, you know, taking x-rays. So guys, I will put like a closer picture in there so you guys can see. But what I ended up taking was this first portion, this first option here with the pano and the 4 horizontal bite wings. You can visibly see the calculus in my x-rays that I had for my patient, and really that is what you want. Now remember, age plays a big role, because if it's an older patient, more than likely if you've seen that heavy tenacious calculus that's been there for a couple years, and it's going to be such a hassle to remove. So I believe I got 2 hours to do 1 quad and 2 teeth from another quad. That quad had to be completed. It had to be polished, free of stain, and then the 2 teeth that I chose in a different quad had to be, I believe, 2 posterior teeth. Also had to be free of calculus and polished, flossed, everything before you return your patient. Guys, I think the hardest thing is just the nerves. The nerves is really what get to you. You know what you're doing. You've done it for 2 years. You know, you are good at what you're doing. It's just the nerves, they really get in the way. So my school did a simulated exam, guys. I was able to bring in my classmate and really go through the examination process, as in checking in, because it is a huge process. So my patient, guys, was an 18-year-old male. He had not had a cleaning ever, and he definitely had calculus in his x-rays. You could definitely see it. I'll insert an x-ray so you guys can see what I'm seeing. It's gonna be kind of hard because my lighting wasn't the best, but you can kind of see I circled where the calculus was. A challenge that I did experience was he had severe gingivitis, so this made it hard for me to see. So when you're working, you know, you want to have a clear field. I use maybe a whole pack of gauze to control the bleeding. As hygienists, you guys know that if a patient hasn't had a cleaning, if they don't floss regularly, their gums are going to bleed. Not necessarily that they're in pain, it's just, you know, there's infection there. He had very big chunks of calculus in there, so it was really easy for me to go in with the Explorer. If I just went in one time, I could feel the big bump, and that is what you want. That is key, because you don't want the judges second guessing if there's calculus. If it's not calculus, you want to feel that big bump. My experience, I had horrible nerves beforehand. I got really sick with a cold, and just the stress was really high. My ultrasonic messed up, guys, so I had to really hand scale throughout my whole examination. I had to really just hand scale. So that was a little bit tough, but the atmosphere at the testing site is just really professional. They make you feel welcomed, at least in my testing site. I had a good experience. So during my examination, guys, the way that they do the probing exam is that the examiners assign 2 teeth to you. So in my case, they assigned tooth number 10 and tooth number 14. So 1 anterior tooth and 1 posterior tooth. And they give me a little box like so. So they assign tooth number 10 and tooth number 14. So the surfaces are distal lingual, lingual, mesial, lingual for both. So you have to write in your probing, and then you turn that sheet in. So at the end, I believe they return all of this to me, because this is my actual paperwork from my examination. So one thing that I could just recommend to you guys is be there early. You don't want to be running late because you only have 2 hours. So and you just want to get familiar with the op. You want to set up, you want to be ready for when your patient is ready to come back. So yeah guys, just the basic points that I just really wanted to touch base again is the age of your patient is really important. So you want somebody that is on the younger side, that has not had the calculus in their mouth for a really long period of time, that it is too hard to remove. Also guys, make sure that the calculus is visibly there on the x-rays, that for sure that you can feel it, and just make sure that it is visible. That is a key. So I did pass guys on my first try, so that's why I am making this video as encouragement to everybody that you can do it. It is possible. It's about choosing the correct patient, and really just not letting your nerves get to you guys. I know it is nerve-wracking, and of course sometimes we can't help ourselves but be nervous, but just do a little prayer and know that you will get through it. So yeah guys, stay positive, stay encouraged, know that you are going to pass this. I hope that my video was helpful for you guys, just kind of hitting the pinpoints on, you know, what I did to choose my patient, what you can do to choose your patient, and I wish the best of luck for everybody. I know you're gonna get through it. Have that faith in yourself. So thanks for watching. Make sure you hit the subscribe button and the like button. Until next time guys, bye.